that conversation just sparked a memory for me on treating an abdominal pain client. Here's an interesting one. There was a patient rang me up from London. She was an Indian lady, and she just returned from India, where she'd been having some visceral treatment from an expat osteopath. So it was a London-trained osteopath who was out living in India, treating expats. And she complained of this right lower abdominal pain. It had gone on for 18 months, 2 years. And she saw this visceral osteopath, and there was a little bit of progress, but it really wasn't making any fundamental difference. Came back to the UK and saw another local osteopath, and that didn't make a lot of benefit for her. So she rang me up on a whim, I think, really, to be honest, just seeking an alternative view on it, really, I suppose. So she came up to see me, and this is one of the issues I have with people who work solely in visceral or solely in cranial, as we were talking about before the show started, is if you're not careful, you can have that hat and just go down that little rabbit hole, and everybody who comes in has got a this or a that, and you forget to look outside the box. So this lady came up with a batch of files, and all the treatments that she'd had in India and the investigations and and I examined her, and there was nothing obvious. And I asked if I could do one more examination procedure on her, which was an intimate area, so I had to get her to sign a form and do all that. And basically, I went up into the obturator muscle, and lo and behold, painful as hell, right up towards the edge of the hip. Other side, perfectly fine. So immediately I'm thinking to myself, this is not a visceral problem. This is a hip problem manifesting itself as lower abdominal pain. And sure enough, sent her off for an MRI, and she had a labral tear, which wasn't an obvious one in the sense that she could move around and do things with the hip without inducing the pain, but that's what was causing the pain. Had the surgery, problem gone.